When I was in my mental health crisis and I was at an intake assessment at the psychiatric hospital, I was talking to one of my intake nurses, and he was kind of just judging me by the way that I looked. Like, he was very much like invalidating the legitimacy of my suicidality. Like, he was questioning me, like second guessing it, and he would constantly repeat like the refrain or something along the lines of, it must be because of your tiger parents and the academic stress that you're under, which is not at all my situation or my circumstance, but that's all he could think about. Like, that's all he could understand, that why I would be there. Like, because why else would I be in the psychiatric hospital? You don't know what I experience as an Asian woman in terms of mental health treatment and mental health crisis just by looking at me. Like, I don't know what you experience. Like, I think that that's also really important, is to kind of look internally and see what our own prejudices and biases are, because we all have them. I think social media really exacerbates this because you're constantly looking at images of perfection. And if you looked at my social media, you would have never known that I was going through any sort of mental health crisis at any point in my life. I think a big part of my intersectional experience has been the cultural dissonance between me and my immigrant Chinese grandparents. I think they never really fully came to understand it, even when I was going through my own crisis. And it's not because they didn't love me or because they didn't want to understand, but they just couldn't. Like, that's not what they grew up valuing. That's not what they were taught ever. My mom, because she does mental health professionally, started talking to me about mental health at a very young age, and she made it a very common household topic. I knew if I felt any sort of way, I could come to her and voice any of my concerns very open and honestly and have a candid conversation about it, which I know that that's a privilege. I know that not everyone experiences that level of candidness when it comes to mental health conversations. After going through my own mental health crisis, I knew that I wanted to use that experience to kind of speak out. Not everyone is able to do that because they're not as comfortable sharing. Since I am comfortable with it, I do think that it's important that I use my voice to tell my story for people who can't necessarily do the same.